Welcome to the first module of the Australian Physio course. In this module, you'll become familiar with the domains and performance indicators given by the Australian Physiotherapy Council as a marking guide for your clinical assessments. In this module, you'll learn the meaning of all the performance indicators, how they affect your performance and results, the most important words and concepts. A common feature of an exam in Australia is that you're told exactly what you'll be assessed on. Knowing the marking rubric inside out will give you the confidence you need to pass the exam, because you know that you're addressing the topics the examiners are looking for. At the end of this module, you'll know the marking rubric inside out, and you'll be ready to prepare yourself to address all the items and pass the exam brilliantly. You'll know how to tick all the right boxes to fulfill every expectation, and how to double check that you didn't forget any, which can happen when you're under the stress of an exam. Spoiler alert, I'll be repeating myself many times, really a lot. So check out this cool word in your dictionary, redundancy, because it's going to be fundamental in your preparation. I'll give you the definition. Redundancy is intentional duplication of components in electronic or mechanical equipment so that operations can continue following failure of a part. This is intentional and fundamental for your preparation for several reasons. Firstly, you will notice that many performance indicators are quite similar to each other. This means that in certain situations, you'll be able to tick multiple boxes, even when you intended to address just a particular one. Secondly, it means that if you follow my method, you'll have multiple occasions to address certain items, even if you missed that certain detail in an earlier stage of your exam. You're basically future-proofing your exam. Past you is already putting a safety net for future you. In fact, during the exam, you might forget to mention something important because of the nerves, most likely. However, the way I've structured this whole course will give you the chance to realize the omission and fix it sooner or later. Finally, repeating a concept over and over, especially in different modalities, is one of the most effective ways to learn a pattern. You just read, listen, write, and then repeat 1,000,000 times if necessary until you reach a level of confidence you're satisfied with. I'm just going to read the performance indicators out and summarize them. This will help you in the future as you just want to memorize them as much as you can. Use the same vocabulary as much as you can, both when you train and during the exam. Print multiple copies of it out and have them close to you at all the time. On your desk, in the car, even in the toilet. When you have a minute, just grab it and read it all. Read it mentally sometimes, read it out loud other times. You're not meant to remember everything in this video right away. The purpose of this video is for you to play it once a week and hear it all over again. This will train your memory in again a different way, so that before the exam you know most of these items by heart and also the exact vocabulary that is used. During this course, you'll hear me talking to you as if I was talking to the examiners or to the patient. These are phrases and structures that I use in my own clinical assessments, and many candidates use in theirs too. So feel free to note these sentences down and use them as much as you can. These items are what this course is based upon. In the next modules, all the advice and strategies that I'll give you are based on addressing all the following marking criteria. Not once, but multiple times, so that you'll be satisfactory in all of them, even in the rush and the stress of the exam. You forget some details. Let's start. Section 1A, 1, refers mainly to the collection of information in the 10 minutes of reading time and during the subjective assessment. Consent is the first thing you need to get from your patient. You mark this session off by collecting information both from the file and from the interview with your patient. So I'll show you how to remember to cover gaps in information. The history includes medical and surgical history and medication. Obtaining measurable data from the file relates to scans and previous tests. Explores signs and symptoms. Identify goals, values, and expectations. Section 1A, 2. Analyze the information and form an hypothesis. This is the part in the presentation when we talk about what we expect to see, just considering the information gathered from the file. Sometimes the information is very basic, so we can just say we have very little information in the file, so I can assume identify potential influencing presentation and differential diagnosis. Here you want to mention other medical conditions that can affect the patient's presentation, either psychological, psychiatric, cardiorespiratory, immunological conditions, or diabetes. Identify assessment needs and priorities. This item strictly relates to determining outcome measures. Check patient's needs against our scope of expertise. You'll check this section talking about referrals. Section 1B1, Design and Assessment. Prioritize and order the assessment, including relevant tests and special tests. Tests need to be precise and relevant to the assessment and outcome measures or goals if you've already identified them. Identify potential problems and contraindications to the assessment. There might be pain, excessive guarding, psychosocial factors. Select appropriate tests and instruments. A test can be too hard or not relevant to the outcome measures or goals. For example, you wouldn't do a 6-minute walking test with a day 1 total hip replacement, right? It would be too hard, and the main concern is unlikely to be cardiorespiratory. Section 1B2, Conduct an assessment. Appropriate depth of the physical examination, including observation and manual testing. Modifications according to the patient's response are an important factor that will let the examiners know that you're not just following a scheme, but you're reacting to the actual scenario. If a patient is too scared to let you do certain movements, make them do it themselves, or make them use a towel to support themselves. Imagine a knee or hip flexion or an ankle dorsiflexion, for example. You must complete the assessment in a timely manner. This is one of the factors that causes lots of people to fail for multiple reasons. For example, if you take 20 minutes to do the interview, you'll miss this mark. You'll be stressed about the time running fast, you'll be less focused, and you'll probably start wasting even more time. Then you'll only have 30 minutes for the objective assessment, the treatment, and the reassessment is just not a good place to be at. You'll be rushing, and if you're lucky and focused, you might pull it off, but in general, it won't be your best performance, and it won't look great to the examiner's eyes. You just don't want to run that risk. That's why I will train you on how to give yourself time goals and achieve them every time. Modify the assessment according to the patient's situation or environment. We already talked about modifications and how important they are. Always ask the patient if they're okay and if they feel safe. You can literally say, "Is this okay with you? Otherwise, we can modify it a bit to make it a bit more comfortable." You need to use tests and instruments correctly. This part might require a bit of extra training by yourself or with friends. If you're not used to using a goniometer or doing certain tests, like the neurodynamic glides, well, you have to practice with friends, family or colleagues until you feel confident with your manual handling. Progressively interpret findings and compare them to the preliminary hypothesis. I cannot stress enough how important it is comparing and summarizing. In fact, there is a specific section of your training just on that. We call it the pause. You'll love it. Identify and assess risk for your patient and for yourself, which leads us to the next section. Section 1B3, Assess safely. Assessing risks and making modifications. This is a bit tricky as safety issues play a big game in this exam. If you do something unsafe, it's game over. We discussed all the risks in the last module of this course, but as a summary, just know that risks can be due to mobility, post-operative protocols, and practitioner issues. I'll teach you how to avoid any big safety issue and use your communication to prevent falling into risky situations. Section 2.1. Compare findings with the normal status of the patient. This means discussing with them the differences with the contralateral limb or their mobility and independence in the past or before the specific event that brought them to see you. Determine how serious the condition is and get them to agree with you on a course of action. This will take place in the pause moments too. Section 2.2. Compare findings with what is expected normally from that condition and include or exclude any differential diagnosis from the hypothesis you might have made at the beginning. There's not too much to add to this. To tick this box, we just need to follow each step. You need to explain the patient that what they're experiencing is due to a certain condition, that what they are feeling is what is expected for this condition. You'll tell them that it's unlikely to be something else, and quickly why. Don't think that you need to give necessarily a definitive textbook diagnosis. Sometimes the diagnosis is already made by the doctor or the scan, which makes it easy. You just need to confirm it. Other times, you can base your diagnosis purely on the findings and on the outcome measures that you've chosen. For example, you can use muscle weakness, overuse, or tendinopathy as umbrella terms, still giving the impression that yours is a likely diagnosis according to the assessment findings, not a definitive one. Section 2.3. Prioritize patient's needs. This is very important, as people can fail the exam if they aim to solve an issue that is not relevant to the patient's goals. You need to keep it simple but specific, and I'll teach you how. Knowing the symptoms and link them to the pathology will help you establish appropriate goals with your patient. Section 2.4. Re-evaluate and justify your hypothesis. You want to share the list of possible diagnoses with the patient and then explain how the findings of the assessment are making you lean towards a specific diagnosis in particular, and not the others. Section 2.5. Identify conditions outside a physiotherapist's skills and refer accordingly. The most common referral are GP for medications or further investigations, occupational therapists for house modifications or hand dexterity, speech pathologists for speech and swallowing issues, psychologists for yellow flags, social workers for house and then economic support, which can be mobility, housework, groceries, childcare, unemployment. Section 3.1. Develop a logic rationale for your intervention based on the assessment findings. To tick this box, you will need to think about the most important findings of your assessment and how improving them will change your patient's situation. Also, identifying potential impact from a patient's lifestyle and attitude. Section 3.2. Set appropriate short and long-term goals with the patient. You'll have to tell your patient about the findings of your assessment and put them in relation to their goals and the GP's or the surgeon's goals. It's all about managing expectations. You want to set goals that align your experience as a physiotherapist, your patient's desires, and the doctor's goals. It's not always that easy. For example, your patient might tell you that they would like to be able to play with their grandchildren by the end of the day, and they just got the hip replaced. You need to be diplomatic and break down the bigger goal into small steps and make them agree on the short-term goal you set together. Negotiation and consent are particularly important to tick this box. Section 3.3. Select appropriate and effective interventions to address the patient's problems. Or better, select your outcome measures and decide how to specifically treat each one of them. Your outcome measure will always depend on patients' and referrers' goals and the assessment findings. Section 3.4. Plan for possible contingencies that may affect your plan. Identify potential influencing factors that can affect your patient's motivation and compliance, both positively and negatively. If they're scared and in a lot of pain, they might not be able to collaborate. So you'll have to teach different strategies or use assertive, reassuring language to educate them and make them become your ally in this exam. Part of this will also be making them aware of the risks that come with the intervention. Section 3.5. Prioritize your treatment in collaboration with the patient. We've already talked about how important it is to select the appropriate outcome measure to achieve the goals. Sometimes, especially if you're running a bit late during the exam, you'll have to select and treat only the outcome measures that are the absolute priority. Section 3.6. Reevaluate with valid and reliable outcome measures. Outcome measures again! You'll see how important they are through this course. Selecting the right ones at the beginning will determine your success at the end. In fact, the last pause moment for your assessment before you leave that room and celebrate will require you to reassess the outcome measures and note the progress. Section 4.1. Obtain informed consent for the intervention. Your patient needs to know what you'll be doing and why, and the risks associated with it. This will require some education and needs to happen before you start your treatment. Section 4.2. Prepare equipment and treatment area. Before you start your treatment, you'll have to decide if you have everything you need or you need to select any additional tool from the equipment room. If you change your mind during the assessment, you'll have to run out again and quickly grab it. Also, you need to look at the room and make the modification necessary to make it safe and comfortable for you and the patient. Whether there's modification or not to do, you must verbalize that you're considering it. Section 4.3. Implement a safe and effective treatment. This is the longest item, but once we break it down, you'll see that you've already prepared for most of its components. This is the benefit of redundancy. It's schematic, procedural, multitasking, and covers you from possible mistakes. You already checked risks and taken precautions. You did hand hygiene before you entered the room. You grabbed aids and tools from the storage room. Now you need to actually do the treatment. While you do it, you must talk at all times. These are the different things you'll need to cover. Questions for feedback about pain, comfort, fatigue, distress, safety. Education about the procedure and some encouragement. Always linking back the treatment back to their goals or the steps agreed upon to reach the goals. And look at that familiar word. Modification, again. Not only the treatment needs to be safe and effective, but safe for yourself too. You checked the environment earlier and you know how to use your hands because you practice endless hours with your friends on using tests, techniques, and exercises. Section 4.4. Manage adverse events. This item isn't assessed every single time. In fact, in most cases it's signed off as a NA, non-applicable. There's mainly one eventuality for this item to be an issue for you. If you did something wrong, didn't consider a safety issue, or didn't consider your patient's situation properly, and this brought a safety manner onto the table. If this happens, please stop and verbalize what you're seeing and how you can modify your plan to solve this issue. Acknowledge and share your considerations with your patient. Please don't pretend everything is fine and push on with your plan. If you're in a hard spot, it's because you did this to yourself by missing some steps. And that's completely fine. Just don't improvise. You'll have the cheat sheet with you that PASS-U has created for this kind of emergencies. Put your patient and yourself in a safe position and acknowledge your mistake. Examiners will appreciate you stepping back and modifying your plan. Section 4.5. Provide self-management strategies. Thanks to the clear information that you've already been giving to your patient during the treatment, you just need to instruct them about how to repeat the exercises at home. You want to talk about specific dosage and different ways to perform the exercises in their home setting. Reinforce the link between what they're doing and how it'll help them achieve their goals. Section 4.6. Suggest health promotion activities. This item links back to the referrals that you can give to the patient. As referral, you must think about other people than health professionals too. A case manager if the patient is on work cover. HR manager if you want to negotiate light duties. Hydrotherapy or group classes. Cardio groups. Parkinson groups, and so on. Section 5.1. Monitor the outcomes. Domain 5 is all about reassessing outcome measures, which you'll do at the very end of your exam. However, don't freak out if you don't. The examiners will still ask you about it during the question time. Either way, this is a very important part of the exam and you must prepare well for it. Stick to the plan, stick to the cheat sheet. You chose your outcome measures according to assessment and goals. You address the outcome measures during the treatment. You assess those outcome measures at the end. It's as simple as that. Section 5.2. Evaluate the outcomes. Once you've reassessed, you need to talk to your patient about their improvement or maybe lack of improvement. The patient will always improve if you selected the right outcome measures. And by the end of this course, you'll be able to select the right ones every single time. You need to share how satisfied you are about the progress with your patient, explaining how the improvements will help them reach their goals, if they haven't already, and how they'll feel after this session. Asking questions like, what do you think? Are you happy with this? Will help you confirm that the patient is satisfied with your treatment and feels better. Section 5.3. Determine modifications to the intervention. If the outcome is minimal, absent, or not every outcome measure has improved, you must verbalize the reasons why it hasn't happened. It's okay. Not every patient improves on the first session. You just need to be humble and tell the patient that you might address things in a different way, as other factors might be influencing their recovery. The examiners will understand that you're open to change and you're not stuck in your ways or in a prefabricated treatment. In fact, they'll still ask about changes and plans for the future in the question time. Section 6.1. Communicate effectively with the patient. You need to be friendly and sympathetic. Listen to your patient and ask for their opinion. I recommend using 90% close-ended question, as it saves you time, especially during the interview. However, you must use some open-ended question. You can reserve these especially for patients' feelings and status, especially when you check on them during the assessment or treatment. How does this feel? How are you going with this? What do you feel? These are very simple questions that will make your patient feel comfortable and listened to. Asking these questions will also get you to tick some of the boxes in domain 3 and 4. Nice. Section 6.2. You need to speak proper English. If you're already past the IELTS or PET with a high score, you should be fine. Practicing with different friends and asking for their feedback will allow you to realize if you make bad grammatical mistakes or if you use phrases that are not really in use. Quick example, my shoulder is paining is a big no-no. Section 7. Safety. We'll talk about safety at the very end of this course, and you'll learn all the details to look out for. You've done it! This module was intense and information-packed. I wanted to print the domains from the APC website and have different copies with you in the places you spend your time the most. You'll throw them away only once you finish the exam. Reading them every now and then will make you completely comfortable with all the specific items you need to address, and especially with the vocabulary used. I'm sure you've noticed already all the words that are frequently used in the items' descriptions. Potential impact, influencing factors, modify, determine, risks, consent. This is not a case. These are all important actions and factors that you need to consider during the exam, even more than once. Also, if you use these words, you're addressing multiple items at the same time. Redundance again! So you're saving time and you're decreasing the chances of the post-exam doubts. I'll see you in the next module where you'll learn how to create the best ally for yourself, your bulletproof cheat sheet. See you there.